Hello, my name is Sylvia, and today I'm going to be performing nasogastric suctioning. As a responsible and ethical learner, I will uphold personal integrity by not engaging in any form of cheating, unauthorized collaboration, fabrication, falsification, or any other act that compromises the integrity of this skill test and recording. Okay, I'm going to come into my patient's room. I have already provided privacy. I'm going to perform hand hygiene, and what I'm going to do is I'm gonna walk up for a second and grab my gloves. I'm so sorry. I'm going to perform hand hygiene, and I'm going to come into my patient's room. Hello, Mr. Smith. My name is Sylvia. I'm going to be performing the nasal suctioning. Can you please provide your name and date of birth for me? Mr. Smith, 10/20/1965. Okay, and I'm going to explain the procedure for my patient and ask if he has any questions. While I'm doing this, I'm also going to be evaluating his face, making sure that there is no trauma in the nose or in the face. Contraindications for this procedure would be low platelets, any coagulation disorder, any face trauma, or any injuries to the nares. So I'm going to be evaluating. Nope, everything looks good. And now I'm going to, I have my supplies, which is my suctioning kit. I have a towel for my patient. I have sterile water, KY jelly, my canister, my tubing for suctioning. My patient is already on oxygen. He's already on 2 liters through a nasal cannula. So before I get started, I want to make sure I oxygenate my patient. However, if my patient needs any pain medication, I will offer it. If he doesn't want any, then we won't give it to him. But if he does want any, then I will make sure I provide it. I'm going to put on my towel. I'm going to bring down this and put him up to a good working height. My patient was already on a semi-Fowler's position, semi-high Fowler's position, but if he wasn't, I would make sure that he was on a high Fowler's position or semi-high Fowler, so it's a good working condition for the suctioning, and also making sure that he's upright. Okay, everything is good. I tested my canister. I'm going to turn it on between 80 and 150, 80 for pediatrics, 150 for adults. I'm going to crank up the oxygen on my patient. And before I have done all this, I would have already auscultated my patient's lungs. I would have performed vital signs. I already put on the O2 machine on my patient, and I'm keeping it on his finger throughout the procedure to make sure that he's not satting, that his oxygen level are not too low. I'm also would have evaluated my patient for any respiratory distress, any low oxygen, and any high O2, and the pattern of his breathing and his respiratory, and also his pulse. I want to make sure that everything is being evaluated prior to me starting the procedure. And I did find that there is a need for me to perform this, the suction, because of his airway is not clearing due to all that gunk in there. Okay, so I will go ahead and get started, removing this gloves, performing hand hygiene, and again, asking my patient if there's any questions. My patient said no, so I'm going to get started. Opening up my sterile field. And I mentioned that I did pre-oxygenate my patient. I want to make sure that my patient is receiving enough oxygen, since I will be removing the nasal cannula as I'm performing the suctioning. Okay, putting in sterile water. The inside of the box is sterile, so I do not want to touch the inside. Before I put on my gloves, I'm going to put KY jelly and put on my gloves. For pharynx suctioning, I'm going to go in 3 to 4 inches. For tracheal suctioning, I'm going to go in 8 to 9 inches. Okay. I'm going to take out the oxygen, the sucking, and like I mentioned, 3 to 4 inches. So now my dominant hand is my right hand, and that's the one that will remain sterile through the procedure. The left hand will no longer be sterile, so no longer sterile. I'm going to connect my tubing. Before I do that, I want to make sure that it works. It's on, is suctioning properly. So I'm going to connect that, and my left hand, excuse me, like I said, is no longer sterile. I'm going to test my tubing now, dip it in water. I could see that it is suctioning. I'm going to put it in KY jelly. Okay. And now what I want to tell my patient is, okay, go ahead and take a deep breath. When I tell you to do so, I'm going to remove the nasal cannula, and then I'm going to be inserting the tube down your nose, okay? Okay, go ahead and take a deep breath now. All right. And I'm going in, suctioning. I will not suction for more than 15 seconds. Okay, and on the way out, I'm going to pulsate on the wide tubing here. Perfect. I'm gonna oxygenate my patient, and go ahead and take a couple deep breaths, please. Okay, clear that out, clear out the line. I still hear that my patient needs another suctioning. So what I will do is I will go ahead and perform the procedure again. So I've cleaned it out, dip it in jelly. This time I will use the alternate nair. So I don't want to use the same nair. And in between the suctioning, I want to wait 30 to 60 seconds. Okay, again, same thing, you're going to take a deep breath. One thing also, what I want to do before I go in and suction again, I want to make sure that the O2 sat is, the numbers are still within good limits, that his oxygen didn't drop drastically while he didn't have oxygen on him, and that he's not having severe adverse reactions. Okay, here we go. We're going to go ahead and do it again. Take a deep breath. And I'm going to go to the other nose. Going in. Okay, no more than 15 seconds. On the way out, pulsating. Oxygenate again. Take a couple deep breaths for me. Okay, he sounds very good now. So now I can determine that all the gunk has been removed. I'm going to take this off. Turn off my canister. Get rid of this. Throw it in the trash. And I want to perform hand hygiene. Put on gloves. And what I want to do again, and I want to listen to my patient's chest again. So I auscultate his lungs. I want to make sure that I observe him for any adverse reactions, like increased tachycardia or any bleeding. And also I want to make sure that his oxygen level did not decrease, or that he's not having any cardiac arrhythmias. So I'm going to check his lungs, check his cardiac, check out his heart while I auscultate his lungs too. Get rid of this and make sure my patient is comfortable. Put this up. Bring the bed all the way down. And then ask my patient how he would like to maintain, whether he wants to stay up high. He said yes, so I will keep him there, make sure the bed is locked. make sure that his oxygen is brought down to the order that the physician had, so it was 2 liters prior. So I will bring it down to that. And then my patient's comfortable, I'm going to take off my gloves, perform hand hygiene. I'm going to document the outcome of the procedure and the MAR, and I'm going to document the characteristics of the sputum. And I am all done with the procedure. Thank you.